Ms Benham.
Thank you, Chair. Afternoon, Minister.
Good afternoon.
You would have seen yesterday in The Age an article about Mildura-based public hospital and the longest ED wait times in Victoria because of inadequate bed capacity and lengthy delays, of course. Secretary, this may be best placed with you, this question. In 2020, Mildura-based public hospital, with much celebration from the government, transferred from private to public management. In 2021, the Department of Health authorised a service plan for MBPH. On the back of this service plan, a $2 million master plan was undertaken. Neither of these plans have been released publicly. In 23-24, MBPH received funding under the Regional Health Infrastructure Fund to plan a new emergency department. Again, these plans were never released. What did the service plan say about ED bed capacity, the hospital's overall bed capacity, and why is this still not in the public domain?
In relation to service planning, if I touch on the Department of Health's role, which is at system level planning, taking a system level lens and looking at a range of inputs to establish clinical scope for different services, hospitals and health services, and start to prioritise for the pipeline. And through that, there are a range of plans that are developed at entity level, at service level, different master plans. But the department plans at that service level, then the Health Building Authority will, once a project has a green light, develop more granular planning.
Sorry to interrupt.
The master plans, a range of master plans are developed at different points in time, but the department would release a master plan once there's an investment decision and the most up-to-date information can be taken into account and released with that plan. So that, you know, for all hospitals and health services at different times, there will be different levels of plans undertaken to inform further work, prioritise.
So we've seen renders from the consultants that were employed to undertake the master plan. They've been found online last week and they've come out. There is a master plan there, that we know that people have seen it. The community of Mildura are desperate to get the emergency care that they deserve, so people are no longer dying in hallways. When can we expect to see the public hospitals master plan?
So there's a third party may have released a master plan. There is not a formal or finalised or authorised master plan that the department has.
It would be a very expensive drawing if that's the master plan. So we can't expect to see it anytime soon?
I don't have any advice I can give you today on a formal master plan that can be released.
Can you give any advice as to what the advice was to what the capacity of that hospital or the emergency department should be for their catchment?
I don't think I have that information with me in terms of the broader system planning that would have taken place for Mildura. Again, the department undertakes that system level planning, and then as projects are prioritised through the pipeline.
If you don't have that, sorry, again, in the interest of time, and it's very limited, can we get that, what the capacity needs to be? Can I get that on notice if you don't have it to hand?
I can see what we can make available, what we have.
Minister, do you have that information?
Look, I don't. And the way that it works is that the work that the Health Department does in conjunction with the local health units is provide advice to me as Health Infrastructure Minister and also to the VHBA to say this is what we need built. And then that goes through the business case sort of process. And
so all we're looking for, because we know the plans have been done, all we need is some indication of what is required.
Look, and I think that's best placed for the Minister for Health, who you've got up on Tuesday, I think.
But if there was an expansion, in your presentation, there was 171 million, I think, to invest in upgrades to hospitals. There are people dying in hallways. Is that not is this scope is an upgrade to the ED in Mildura
We
part
have
of
not
that?
been commissioned to upgrade that at the moment. The Department of Health is working on the service provision in Mildura, but that is a matter for the Minister for Health.
Okay,
And
can we
if
get
I
that
could,
information on
if I
notice?
could, Minister, and that's quite right, Minister Thomas will be here on Tuesday, and there, outside of any master plan, there are a range of investments, service improvements, a lot of close work that the department is doing with Mildura Hospital. But, I don't want to speak for the Portfolio Minister who will be here on Tuesday.
So, but you mentioned the service plan, so do you have visibility of the service plan?
No, I do not.
Okay. And I understand what you're saying as far as all the planning and things go, but you can understand the community's frustration in that it's been 5 years with seemingly little intent to invest in that infrastructure. We're just asking for if there is a plan to expand the
And I don't have that information for you. You are best placed to raise those questions with the Minister for Health.
Okay, but if the Secretary, like I mentioned before, could see what she could find, that would be... Is that okay?
Yes, we'll see what's available.
Okay, thank you. As far as community hospitals go, and this is a reference to budget paper 4, page 63, in 2018, the Andrews government made an election commitment to fund 10 community hospitals at a cost of $675 million, located in, and I'm sure you know, Minister, the Cranbourne Hospital, which is complete but not operational. When will this hospital be operational to deliver what the government has promised?
So thank you for that question. And the community hospital program is precisely that.
Come back to that.
Sorry.
Stop. Back
Thank you.
this way, Mr. Galea. Ms. Benham.
Me again. Thanks for the cannolis, but it's not going to make me ease off. One hospital that doesn't have a helipad, and there was a lot of time spent on the helipad in that last session, Cranbourne. They don't, in fact, have anything. So some quick fire questions, Minister. The Cranbourne Community Hospital, when will surgery commence?
Well, as you could appreciate, with community hospitals, as I said, we've got a number of hospitals in this entire package. Cranbourne, major works are complete, but what we need to do, and I think it's a good analogy for, like if you're building a new house, for example, you can move into a new house and you've still got some defects, and you can still have your builder, rectify some of those defects. The process in any sort of health environment is there's zero tolerance for errors. So you need to go through and make sure there's that
Do
commission.
you have a date though? I've got a few other questions. Do we have dates when surgery will commence?
We need to make sure that it is absolutely perfect. There is nothing that is, it's going through that commissioning phase at the moment.
What mental health services?
Well, mental health services obviously have got, there's still the kit that is needed, like there's still equipment and things like that is needed, and all testing needs to be absolutely
What
correct.
about the urgent care? When will that be up and running?
Well, as the commissioning occurs,
No date for that either?
well, it will be ready when it is ready, because we need to make sure that there are absolutely no defects and everything has been commissioned perfectly.
What about the specialist services that the government promised? Any date for that?
Well, I'm answering the answer to these questions will remain the same, because that is where we need to
Okay.
continue to go through that commissioning
That's
process.
fine. So have clinical staff been recruited at all?
That'd be a matter for the
Health Minister?
The Health Minister.
Okay. You don't have any further, there's no plans for, no solid dates at all that you could provide to us later? No further information on that?
Well, look, we just need to continue to work through the process. I mean, I can ask Priscilla Radish, who you haven't met before. She is the new CEO of Viva, to talk through maybe some of the works that are proceeding at Cranbourne.
Cranbourne Hospital is one of the community hospitals that we are delivering for Department of Health. And so when you do that final testing and commissioning of the building, you do that step with the health service, and the health service needs to work through their staffing, their training, and their scenarios, which does link back to the health service and the Department of Health and that phasing, which is separate from the building component.
Sure. When will the commissioning be complete then?
That's in line with which services come on at which time, which is a sequencing matter.
So the questions that I was asking before aren't in fact the same question. I was accused before of asking the same question repeatedly, and you've just answered that question saying they're not. The services come online separately. So when will the commissioning commence and end?
But
The Minister had indicated the commissioning had begun. So when will the commissioning be complete?
So the commissioning is different for different hospitals and different services, and it depends on the health service and which services they're turning on at which time.
Are you able to
align
provide us
them.
on notice the dates on which the different services the commissioning will be complete?
Well, if I can just jump in there, because the completion of the commissioning and the start of services is really a matter for the Health Minister, and it's that operationalisation of health services that sits well and surely in the purview for the Minister for Health.
But the commissioning of the infrastructure itself sits with your department here and now, so we're just after some dates on when the infrastructure will be finished and ready for clinical staff to be recruited and services to begin.
We can certainly provide you with information about the completion of Cranbourne Community Hospital.
Great, thank you, Minister. Could you also please provide a breakdown of the services for Phillip Island Community Hospital, which was also promised to be open and operational in 2024?
Look, I don't have a list in front of me, sorry, of what Phillip...
Take that on notice.
No, I can tell you it's on track to be completed by the end of the year, and certainly we can provide you with a list of what those services
So
are.
you'll provide that for us?
Sure.
Thank you very much, Minister. Are there any, well, I suppose if the recruitment process hasn't been done, there hasn't been any consideration given to workforce challenges? Secretary might be able to answer that.
Well, I think it's just, as the Minister has said, once the infrastructure is completed, the commissioning sits with the health portfolio. Minister Thomas will be here on Tuesday, and I'm sure she will be happy to talk through that with
She'd
you.
be thrilled to talk about that, I'm sure. How much of the total investment of the 870 million has been expended on Craigieburn Hospital?
I don't have that detail at hand.
You can provide that on notice.
We do have, major works are complete out there, and already we've got a new pharmacy and extended dialysis that's being delivered out there, but I don't have... 20.76 million over four years. That's correct, Secretary?
That figure was?
20.76 million
20.7.
over 4 years.
Thank you, Minister. Secretary, one last one before my time runs out. Can you tell the committee why, after a 4-year delay, this year's budget shows the completion date for all 7 community hospitals as Q2 2026-27, conveniently around the time of the state election?
Well, I can answer that. We take a programmatic approach. And so we deliver these over time, and so it's sort of like a rolling program, which is why then...
Into election time.
Well, they're built when they are built, and they're operationalised when they are ready to be operationalised.
Thank you, Minister.